Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC,
all right, whenever you're ready.
And get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. And today we will learn all about delivering babies by Cesarean Section and how to ensure a healthy pregnancy along the way. Our guest today is Dr. Alan Lindemann, an obstetrician and maternal mortality expert who, in his nearly 40 years of practice, has delivered around 6,000 babies and achieved a maternal mortality rate of 0. Dr. Lindemann, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Well, thank you very much for inviting us.
So before we begin, tell us a little bit about yourself and why you wanted to become an obstetrician.
Well, that happened during my third year of medical school at St. Paul Ramsey. I realized that the obstetrics was the only field where you could choose your outcome. In other words, if you are in internal medicine, you're fixing up a heart that doesn't work, or you're in surgery and you're taking out an appendix or gallbladder. But with obstetrics, we had a blank slate. And I realized early on that I could help mothers make decisions which were good for themselves and good for the babies.
What a wonderful profession. So let's start talking about cesarean section deliveries. Can you explain the procedure itself?
Yes, I've done about 1,000 of them. Generally speaking, we use what we call a fan and steel incision, which is transverse. In other words, it goes across the belly rather than up and down. And then there's muscles in the abdomen called the rectus muscles. We divide those. And then we have the peritoneum, which is the sac that surrounds the uterus and the bowel. And then we finally get to the uterus, make an incision, again, transverse, and deliver the baby's head or butt, whatever comes first.
Very interesting. What is the rate of C-section births in the United States, would you say?
Well, it's around somewhere between 30 and 33% and on the rise.
What would you say the reason for that as opposed to vaginal deliveries?
Well, there are several reasons. In the first place, I think that we could reasonably lower the C-section rate. When I had my first practice, my C-section rate was 10%. But I think there are other reasons, too. Insurance pays more for cesarean sections than they do for VBACs or vaginal birth. And I think there's a little bit of an incentive there. The insurance companies, if they really want to control the C-section rate, should pay the same as they do for a vaginal birth. And I think we'd see some action there. Also, we need a federal plan. You know, in most places, most countries that have a federal plan, they really follow you for a year. Canada does that. And I think all of these things would promote the health of our mothers and babies and fathers, too.
What is the risk if a mom was having a C-section? What is the risk of having a negative outcome with the birth of her baby?
Well, the main risk problems would be ligating a ureter. And the ureter is the tube that goes from the kidney to the bladder. And that's fairly common. It's nothing like 10% or anything like that. I'm sure it'd be less than 1%, but it is probably one of the most common problems. Another problem is bleeding, which is difficult to control. And sometimes moms even lose their uterus in order to stop the bleeding. That's called a C-hyster or a cesarean hysterectomy. I have never done one of those things in my 1,000 cesarean sections because I've never needed to.
So that places the mom at high risk. How about the baby? What are some of the downfalls of having a C-section when it comes down to the baby?
Well, there's a couple problems for the baby. You can always make an incision in the baby's forehead or the baby's cheek when you're trying to make the incision in the mother's uterus. The other problem is that I think labor really helps babies get ready for delivery. It helps them breathe better. So I think that our C-section babies, we really have to be careful with how far along they are, because even if they're as old as 39 or 38 weeks, I think they're more likely to have breathing trouble than a normal vaginal birth.
Mm-hmm. Yes, something about the vaginal delivery pushes all of that excess, I guess, fluid from the baby so that they can breathe better. Is that the reason?
I think that's one of the reasons. The other thing is that when you have a vaginal birth, you have the baby has more of a decision, or has a bigger part in the decision to have labor. In other words, the baby makes the labor.
Baby's in the driving seat, right?
Exactly, and that's good for the baby.
So when you talked about the economic piece of a vaginal delivery versus a cesarean section, what are some of the questions that I can ask the obstetrician or surgeon prior to choosing them to see if they would push me more towards a C-section or a vaginal delivery?
Well, you could certainly ask them what their cesarean section rate is. It varies a lot from one hospital to another. For example, you can have a cesarean section rate of 7% or a C-section rate of 70%, depending on what hospital you choose. And it's a reasonable question to ask.
And is this information something that I can find on a website, or do I have to ask the surgeon or obstetrician themselves?
Well, you certainly could ask the obstetrician and try not to alienate them too much. The hospital should have some on its website, some kind of information about its cesarean section rate and the healthy baby rate, the NICU rate.
So if I had a C-section, what is the chance for my next pregnancy that I have a vaginal delivery?
It depends a lot on why you have the cesarean section, but one of the things I did to get my C-section rate down to 10% was a repeat cesarean section. And I have been a big fan of those for many years. I have seen very few fail. I even had a lady who came in with 4 previous C-sections, and she had a vaginal birth.
Wow.
Without any trouble.
So why is it said that once you have a cesarean section, it makes the chance of a vaginal delivery higher risk? What is the risk there involved after a C-section?
It has to do with the incision on the uterus. It also has to do with the anxiety of the physician. Certainly, the incision that would go from up to down or stay, midline, that's the one where we usually would say you should not even have a trial of labor. You should have another C-section. And I have to say, I don't think I've ever done a repeat C-section on a lady who has had a midline incision. On the other hand, I probably have only seen about 3 patients who've had the up and down, the vertical incision in the uterus.
So when you're doing a C-section on a mother who has had a C-section in the past, what kind of incision do you do? Do you go exactly over where the incision was done previously? How do you approach that?
I would approach it by going exactly over the previous cesarean section, because if you have a space between the first and the second C-section, that's going to make a weak incision because the blood vessels cross the incision with some difficulty. So you really should have them meeting where they met before.
You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about delivering babies by cesarean section. and how to ensure a healthy pregnancy along the way. Our guest today is Dr. Alan Lindemann, an obstetrician and maternal mortality expert. In his nearly 40 years of practice, he has delivered around 6,000 babies and achieved a maternal mortality rate of 0. What is the evidence when we talk about the maturity of a child born by C-section versus a vaginal delivery? Is there a difference? Does the evidence show that they develop differently?
You know, it's a really good question. We don't have, as far as I know, any answers to that. The other question we don't have an answer for is, how does Pitocin influence a child in their development? For example, a 4-year-old, is that child different because they had Pitocin? We don't know that.
So when you have a mom who's coming in and they've had their mother, for example, they have a history because of their maternal history of cesarean section, does that make that woman more prone to have a cesarean section because of a weakness or because of just a tendency for that need?
Yes, it's something you pay attention to. It's not an absolute. I have delivered many mothers vaginally whose own mothers gave birth by C-section. So I would offer them a trial of labor or a trial of labor.
So I know you have been an obstetrician for more than 40 years. How has the procedure of a C-section evolved over the years? What have the new developments been?
Well, I have seen over the last 40 years, of course, we off and on, sometimes we think that VBACs are good, sometimes we think that they're bad. But I think one of the major changes, evolution in the cesarean section, is the outside incision. In other words, is it vertical or is it horizontal? And I always prefer the horizontal incision because I think it heals faster and easier.
Would you say the incision horizontally is less visible?
Yes, I would say it. As a matter of fact, if you wanted to wear a bikini, you could wear one.
So in terms of the incision that you're making for the cesarean section, can the abdominal muscle heal to a point where you see nothing after time has passed and once that incision is healed? Or you see very little?
I would say that you do have a good chance of having a return to normal or pre-C-section configuration.
What would you say in your experience with COVID pandemic? This is fairly a new thing. Has the vaccine itself influenced C-sections or deliveries of babies at all, in your view?
I have not seen a lot of change. In other words, I've seen mothers who've had COVID, who've had no treatment, and who have living babies and apparently healthy babies, and the moms have been healthy themselves. We've had a couple patients who've had Regeneron, which is, as you know, an antibody. And now, of course, that's out of style. We can't give that anymore because of Omicron.
So your website, you teach women how to steer their own pregnancies. What do you mean by that?
It's a choice. And it's a couple of days ago, I was talking to somebody who said, oh, knowledge is power. And that's what this is all about. I want to make sure that moms know what their decisions, what their choices can be. For example, if I see somebody with a blood pressure that goes a little bit high, I'll send them to the hospital for some checking, and the nurses will check a lot of times until they get a lower blood pressure. But I always pay attention to the high blood pressure, and if they're working, 3 12-hour days, I'll tell them to cut down to 5 6-hour days. So some of the decisions to make when you are pregnant.
So when a mother first finds out that they're pregnant, how long do you see the mother after the baby has been born?
Well, I always like to see moms around 7 or 8 weeks. And I do that because if they have a miscarriage and it could be that their miscarriage rate is up to 25 or 30%. But I like to be there for them if they need somebody to be there through that difficult time.
What are some of the most common things women don't like to ask you when it comes down to their pregnancy in general?
I've never thought of that question, but I expect there's an awful lot of women who would not want to ask me about my mortality rate. Not that I'd be ashamed to tell them, but I think they might be embarrassed to ask.
So would you say that being a male obstetrician, that you have no hesitancy with women coming to you as an obstetrician, or would you say you have not met any kind of hesitancy as a male obstetrician?
I would say that, of course, I'm old. And years ago, it mattered less. I mean, being a male mattered less to women. Right now, it's pretty popular. Women want to go to women. So I would say that there's a lot of people I wouldn't see because they would prefer to go to a female.
So I think it's marvelous that you have a mortality rate of 0. Do you ever train other practitioners or have practitioners shadow you to see, your practice and procedures to learn from you?
We have made a website. It's called ruraldocallen.com. And we have another one, lindemannmd.com. And incidentally, Allen is ALAN.
Spell the whole thing for us.
It's rural. It's RURALDOCALAN.com. ruraldocallen.com.
And what's on that website?
Well, we have several free things. We have, I had delivered a patient a set of quads, and we've had a good relationship. I think now they're about 22 years old. We went to visit them.
What are quads, by the way? I didn't interrupt you. Quadruplets?
Yep.
Wow.
And so we went to visit them, and we talked for an hour, and that is on my website, and it's free.
Nice. That's really nice.
Dad changed. He was kind of an important caretaker, and he said he changed 7,000 diapers a month.
You're listening to Your Family's Health and the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about delivering babies by cesarean section and how to ensure a healthy pregnancy along the way. Our guest today is Dr. Alan Lindemann, an obstetrician and maternal mortality expert who in his nearly 40 years of practice has delivered around 6,000 babies and achieved a maternal mortality rate of 0. So that's very, very, I would say, rewarding profession that you're in to have delivered quads. Have you delivered any, I'm sure you delivered twins.
As a matter of fact, I've delivered. In my first practice, I had 4 batches of twins in the first 6 months.
Wow.
All born vaginally, by the way. And I even had one set where they both breech. So I delivered 2 breeches vaginally, and that went fine too. So I don't think we should be afraid of breech deliveries. It's just a matter of doing them the right way.
So is there ever an issue where you have a baby that is breech and you try to turn them before they're born?
Yes, that was one of the things I did in order to get my C-section rate down to 10%. That is a painful procedure, but we do always tried to get some, agent to relax the uterus. You have to be just careful, when your mom says, this hurts too much, you just need to stop and either try it again or just stop it.
What is the oldest mother you've ever delivered?
I would say, when I think of it, it's about 46
Oh, wow.
years.
Okay.
And it was her first baby.
Oh.
It was really her own. She wasn't infertility. It was all spontaneous, her own.
And the youngest?
12.
12.
Yeah. Well, I had one patient who delivered at 12, and I think she had 3 children by the time she was 18.
Wow.
Yeah.
So when you talk about delivering babies, and it's a very rewarding, does any of the children ever come back to say thank you?
It's kind of interesting you should say that, because a couple weeks ago, I got a letter from a man in St. Paul, and he was telling me that I was laughing at his feet when he was born because they were so big. And that was a story that his mother had to tell him. But yes, I get, every once in a while, we get somebody. As a matter of fact, the older our website gets, the more people we get from the past.
Well, so you'd be surprised how many people are walking in the United States that have been one of the hands that helped them to be here, right?
It's been fun.
Yes. So what about postpartum depression? Is that something that's avoidable? Do you see a lot of that?
That is really a big issue, a big problem. One of the ways I have always tried to deal with it is to not have it. In other words, I bring along the mothers, they come in, the children, and the husbands. Everybody comes in. I get to see the family dynamics. I get to see where the support is coming from, and I get to see the problems. So if all of that fails, then the first thing I would do is I have always had a good psychiatrist that I could call, because it takes sometimes 6 or 8 weeks to get to see a psychiatrist. So these moms need treatment right away. No messing around with it, because you don't want them to go into postpartum psychosis. Yeah. And that's very dangerous. It's homicidal.
Yeah.
So what I've always done is I've called the psychiatrist. We agreed on the antidepressant or the anti-anxiety agent that would be best for this patient. And then I would see them every week or more if they needed to be seen. And then I would hand them off to the psychiatrist.
So I know that your mortality rate is 0. How many babies have you delivered with a birth defect, an anomaly?
Well, when I come to think of it, it's not that many. It's probably been about maybe 4 or 5.
Oh, because then that has nothing to do with you. That's all about the development of the child in utero. So that's only 4 or 5 in the 40 years. That's something.
Well, we've had some pretty healthy moms and dads, so I guess that helps out a little bit.
Have you ever delivered a baby outside? I know everything happens in the hospital, but have you ever delivered a baby in the home setting?
Not in the home setting, but I've had a couple in the office. They come in for their appointment, and the receptionist doesn't realize that they're in labor. But those have turned out to be no trouble.
So you have a setup, obviously, in your office that just in case.
Oh, yes. We are prepared.
So what hospitals are you affiliated with?
Well, right now I'm working with, it's called Jacobson Memorial Hospital, and that's in a small town, Elgin, North Dakota.
So that's primarily where you work, or do you work other places as well, or is that your primary location?
This is my primary location, but I do, of course, now that I'll be 74 in 2 days, I spend a lot of time with nursing home people, because I think that's fun, and they're not afraid of my being 74.
How would you say if once the mother has had a C-section, how do you treat stretch marks? So how do you prevent those things from happening?
Well, that's a really good question, and a lot of people ask it. And I would say there's not, you can think about things to apply, like vitamin E and some other things, but there's not a really good way to prevent stretch marks. It's, for the most part, either do or don't get them.
So Where can people find, I know you gave us a website. Is there any other website that you would like to share with our listening audience?
Well, I do have the LindemannMD.com.
Okay, and spell your last name for us, please.
LINDEMANN, MD.com.
If you wanted to leave one thing with our listening audience about C-sections or being the obstetrician that is so really, really successful in how you have been able to deliver and really allow your practice to flourish very with positive outcomes, what would you say?
I would say it is the relationship you have with your patient. You have to know them and you have to care about them. If you can't, you should have them go to see somebody else. But I haven't had to do that. But certainly that relationship is the most important thing. It's also important when it comes to labor, because there's a lot of times my patients would feel most comfortable being delivered by me, by the one who they've seen. As a matter of fact, we have a little story. The quads lady talks about how the nurses wanted her to have a different doctor for delivery, but she said that was not going to happen. It didn't happen either.
That's good. And I'm sure she's glad that didn't happen either, that she stuck with you. Well, thank you for being here, Dr. Alan Lindemann, an obstetrician and maternal mortality expert. We hope you stay safe and continue to stay healthy. And thank you for being our guest today.
Well, thank you very much.
This is Dr. Jeanine Cook from the nursing department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.